Hey guys, Jared here, Magnetic Men's Club. Today's video is a little bit different. I'm going to go into the cosmetic queens, to my homegirls, Jenna and Stacey. They have a brand new practice up here in Fulton, New York. And these girls have been with me for about 10 years. They do my Botox. They do some skin regimen with me. I buy my products through them. And so today we're going to talk to you through them on why it's important for men to maintain their skin, why it's important to look your best. And so today we're going to do a procedure. I forget the actual name. Stacey is going to kind of tell us a little bit more about that. But they're in Fulton, New York. It's a brand new company that they started. Stacey is a physician's assistant and Jenna is a nurse practitioner. So we're going to go in and start this process. So the procedure that I'm doing today is called Sculptra, and I've always had a problem with the underneath of my eyes. It's a little bit hollow, and then I get these wrinkles. And again, I am 48 years old, so it is expected. But if there is a medical treatment or a process, then I want it. I don't want to look my age. I don't feel my age. I don't act my age. So why look my age? So Stacey recommended this about 2 or 3 weeks ago when I got Botox. I couldn't get it the same day because, and she'll explain it a little bit more, but you have to massage your face for about 5 minutes every few hours. You have to let the Botox set in before you get that. So we're going to be concentrating on underneath the eye today. And it's really just, again, kind of beat out father time as much as possible, because the only other option that I have is called a lower bluff, I believe it's called, where they actually cut and pull under the eye. And you can only do that once. So I want to wait as long as I can before I absolutely need that. So she recommends Sculptra. She's been getting great results from it. So that's what we're going to be doing today. So we just talked about, it's called Sculptra. Stacey is going to explain a little bit about what that does and how it works and how it's going to benefit me in the long run.
So it's basically injecting tiny little collagen seeds into the face. And what those are going to do is they're going to actually let Jared's own body produce new collagen. So this is out of this world. There's Sculptra and Hyperdilute Radiesse. We carry them both here. We chose Sculptra for Jared, and what that will do is give a subtle volume without overfilling his face, because if we were to fill all of this tissue, he would start looking weird, and we don't want him to look like a Beverly Hills housewife. So we just want to kind of tighten some of this area. So it is an injectable. We're going to put some in the temple, some in the cheek, and some in the back of the jaw. So he's going to get some nice lifting from that as well. So Sculptra takes about 3 to 6 months to see results. The nice thing about Sculptra is it's very reliable. I know exactly what it's going to do, and it has the same results on everyone, regardless of who you are, what your skin type is, what Fitzpatrick level you are. And so really, if you need better results, you just need a little bit more. So usually we start people with a syringe or two, or a vial or two, and then we reevaluate at that 3 to 6 month mark. You can repeat it as soon as 6 weeks, but I like to be a little more conservative. Obviously, less is more. We don't want to do more than we need to. It'll save money, and it will also not be necessary. So the nice thing about Sculptra too is people see a huge increase in the skin texture and like the quality of the skin, because you are building brand new collagen. And this procedure lasts, anywhere. The studies have shown people still feel like their results are, the same as when 3 to 6 months for 5 years or so, but the studies go all the way up to 2 years, which is nice.
Obviously, this is for a men's channel, and of course, you're low-hanging fruit or women. But yeah. What are other things men can do?
Yeah.
I met you. Well, I met Jenna first, but I met you about 10 years ago. I've been doing Botox, and there's different kinds of Botox. I think Botox is just the name of
one of them. Yep.
And for me, Botox has been the best one. The other ones just didn't seem to work as well. But as a man, as we're aging, again, I'm 48 years old. I kind of started my Botox at around 37, 38. What when would you recommend a man to actually start? Because us as men, we don't really care about our skin until it's later.
Too late, yeah.
In our life. And so
so I feel like the aesthetic industry is really kind of trying to get people into prevention first, because it's much easier for me to prevent the aging process from happening than to correct it. Obviously, we can do things for correction, but we actually do have quite a few men. And the nice thing is we've made the procedures quite tolerable. So some of my men come in for neurotoxin, which there are a bunch on the market. Jared was just talking about, there's brand name Botox, Dysport, Xeomin, Jeuveau, Daxxify, there's a bunch of them. And they all work by basically stopping muscle contraction so that you're not creasing the collagen and elastin out of the skin. So they really help minimize the wrinkles before they even occur. Now, if you already have those wrinkles, it does have the side effect of stopping that creasing, so you're not going to have any worsening of the wrinkle, so it kind of puts a pause, and it allows the skin to heal. So with good skincare and SPF, you can actually reverse those wrinkles. I liken it to if you're going to crease a piece of paper multiple times, you know, it's going to take a while to let that flatten out and smooth out. You might have to put a couple books on it to get it smooth again, but so that's one procedure. Another procedure that actually my own father even had is PRF. And that's where we draw your blood, spin it in a centrifuge, and then re-inject just the platelet-rich fibrin off the top right back into the skin. And so it's all your best healing, and the cells are still alive, so they actually go to work at regenerating areas. And so a lot of times people will use that as an under-eye treatment before we do like a tear trough filler, and it tightens and brightens the skin. So you can use it, you know, in the nasolabial folds. Some people have heard of the vampire facial. They used to have microneedling and then get this on as well. But that is a nice option, especially it's a natural option. So a lot of men are concerned when we say, oh, we should use a little filler, or we should use a biostimulant. They like to try something natural first, which is our whole, you know, claim to fame. We want everybody to look themselves just rejuvenated, not weird, fake, puffy.
And one of the biggest things I read up on, even though women dominate the market, the men's space going into getting these cosmetic procedures is accelerating. So if you are a man out there watching this and you kind of feel like, oh, that's just weird, I wouldn't want to do that to my face, you know, you might have that thought that that's only for women. The idea is to look the best you can. And the idea is to look the best you can for yourself. Forget about women, forget about all that. It's just for you to feel and look the best, because that's how you operate. If you look the best and you feel your best, you operate at your best self. And that's what this channel is about in all forms, whether it's dress, whether it's just skincare, whether it's going to the gym, drinking your water, having a positive mental attitude, all of that stuff brings you up to being your best self. And that's why I wanted to document this with Stacey, because I do have a lot of guys asking me, like, you got tattoos all over and you do this. Yeah, because I want to look my best for me, not for external reasons. It does help with women, don't get me wrong, but I like to look in the mirror and see the best image I can. And if it does take some of these biostimulants, if it takes Botox, if it takes this, then that's what I'm willing to do. And so you got to treat this as an investment. It's an investment in you. It's an investment in your brand. And we always talk about you are your own brand. So you want your brand to look its best. Well, I can't wait to get this thing going.
All right, let's go stab Jared in the face. Sculptra. So this is the tiny collagen seeds. We mix it all up.
Now, what do I have to do after this?
So you're going to massage 5 minutes, 5 times a day for 5 days. And I'm going to do your first massage so you'll know exactly what to do.
Oh, nice. Should I take my pants off for that one?
Oh, Jared.
Boy.
The idea is if we kept this all in one area, you could get what's called little tic tacs underneath the skin of collagen.
Okay.
So we just want to keep making sure that that's distributed through the tissue well. Okay. We love to go through the things of why are we doing this to you? And this was a perfect example. So this is Jared's kind of area of concern. Mm-hmm. So he's a fit guy. So the muscles in his face are still really prominent, but his actual fat pads in his face, he's not a puffy face guy. So like I have big fat pads in my face, and it's more noticeable in my jowling area because I have such big ones.
Right.
You don't. So we're seeing that separation. But again, we have this skin laxity. And so if I filled his cheeks to the point where it would kind of fix some of his concerns, that's a lot of skin and he would look weird. So we got to tighten the skin up. And then if we need to add a little bit of volume, we can do that easily. But I like to show you like what's actually happening with the age related changes so that you can see, when you were younger, everybody kind of has like this nice triangular shape where the chin is kind of the bottom of the triangle. And as we age, that triangle flips. So we got to pull things back up. Smile again. This whole section needs to be tightened. And then open your jaw wide. And then you can see how much skin laxity we have there. And that bothers him, because when he smiles and he's always smiling at people, that is bunching up there. So we have to tighten that all up. This, we're actually using a cannula. And so I'll make a little poke with my needle to have an insertion point. And then I don't know if you can see this, but we'll try and get it on Jared's black shirt. It is actually a rounded tip. And it actually has a little hole on the side, so it deposits the material, and it's very flexible, if you can see that. So it actually creates less trauma. A lot of guys are like, I don't want to know that that I saw. Like, I don't want people knowing that I came to Stacey and Jenna.
Right.
So, and that's
same I get with Scalp International Hairlines. Guys don't want to know they don't want people to tell them they got something done.
Yeah. So,
that's why.
There's kind of a stigma with aesthetic procedures.
Yeah.
Some people don't care, but some people are very private about it, which is totally fine. So this minimizes the trauma, bruising, swelling, and kind of lets us get into the right plane because we want to be, in an area that's creating collagen. We don't want to be in the wrong area where it's not benefiting you. So little pinch. So that is to get the actual port site for my cannula. You can see he's not even bleeding. I'm just going to put this right in. And a little pressure. How are you? Mm-hmm. And then you can see that we're just putting the product right in underneath the skin. You can actually see it happening. So all of that area is going to lift. I don't know if it's just because you guys have the camera today or what, but that was the smoothest we've ever done.
Nice.
And then we'll go this way. Oh, see, I spoke too soon. And then we'll start doing this area. And this is the main area we want to focus on because that was what his concern was when he came to us.
Yeah.
So this is really the area that we want to be building and tightening on him. How you doing? How's the pain?
Well, that's not bad.
Any stinging?
Nope.
Good. So pretty easy, comfortable procedure for the patient. Not anything dramatic like a bunch of needle pokes. We're almost done with this side. And people always are like, you're not stabbing me with that big needle. But again, you can see how flexible this is.
Yeah.
And that it's really not. There is some lidocaine in the product. So I always tell people if you're starting to feel any, numbness, that's a normal side effect. And we're just about done here. I'm going to grab one more spot. He's being difficult and not letting me there. There we go. Okay. So So I don't know if you can see the difference between this side and this side. You can really see it if you come back here. You can see on this side how much better when compared to this side. So if you stand right in the middle, do you see how all of that's kind of, and now smile, you see how much more symmetrical? And all of that's going to lift for him, which is going to be really nice.
Wow, yeah.
So just imagine where that volume is, you know, and we'll obviously massage this. Isn't a volume treatment. If it was filler, we'd want to be very precise with where we were.
Right.
You know, but this whole area, now smile.
Much better, yeah. Yeah.
So all of this is going to be tightening in this area.
Mm-hmm.
And, you know, that's why if we need another treatment, we do another treatment, but less is more, and it still looks very natural.
Yep.
So you want to be massaging away from your eyes.
Okay.
So you can either do like a V and kind of run up and down your cheeks.
Okay.
Or push down and away, because you don't want to massage this up. Now there are ligaments and things that are here that are going to prevent that from going into your eye or something, but we want to be lifting and pulling away from the eye.
Okay.
And then you can see I'm doing either like long strokes or like little circles, and you can see that when I was injecting it in kind of a fan anyways, so probably if you did nothing at all, it'd still be perfect, but this just really guarantees us great results. You can see, nobody would really know he was here today. He's slightly swollen in this area, and it'll go down within, you know, anywhere from 2 to 12 hours. Tomorrow, nobody will even know. Here's his before, and here is his after. And already the symmetry of his face slightly improved. And then you can see that this is your side that has a little less volume. Mm-hmm. So we may need to do more over here the next time, but you can see in this temple area how that looks a little better and how these lines are all going to be affected there.
Yep.
And then what I really see is, look at that.
Oh, wow. Yep. Big time.
So if all of that is really tightening and lifting, we're not going to look like he's just sunken here. It's just all continual, and it's really going to help that eye area. So
nice.
Go. Yeah.
That was it, kids.
That's it.
Didn't hurt at all. The value. Sculptra. So Google it, take a look at it, hit their link below, and book that free consultation, or even better up, just come up here and get it done. Take care, guys.
Bye.